everyone, this is Zxiakira C. Prodigalidad from Nursing 216 and I am here to demonstrate and explain assisting the client with the use of incentive spirometer. So first, for the assessment phase, we have to make sure to identify which client will benefit the most from this procedure. So of course, the first one is those with pulmonary diseases, the overweight clients, and also those with deliberating chronic illnesses. We also have to assess the client for any confusion, malnutrition, cognitive impairment, or any impairment in the motor skills. So we also have to check for their respiratory status, for example, their systematic depth of their shoulders. We also have to check the respiratory rate and the depth, and also the lung sounds of the patient. We also have to assess the level of pain of the patient, or if they are experiencing any pain. And also, lastly, we have to review for the healthcare provider's orders for the incentive spirometer. So for the nursing diagnosis, we have to check for impaired gas exchange and ineffective airway clearance. So for the planning phase, we have to make sure that we have the needed materials, which is the incentive spirometer. So there are two types of incentive spirometer. We have flow-oriented and volume-oriented. And also, we have to check for the expected outcomes or goals that we will achieve at the end of this procedure, which is we have to explain to the patient first what we have to do and why do we have to do it. We also have to explain the procedure to the patient or the guardian of the patient, which is their family, their friends, or any guardian present. And also, we have to reach the target volume of the patient that we will happen to receive once we complete the procedure. We also have to tell the patient what the number or the indicated volume we will reach for that procedure. For example, if we have to reach 2,000, you have to tell the patient that we have to reach the 2,000 ml for today, and also indicate if we went under or above the indicated volume. So without further ado, let's get to the procedure. Good morning!
Good morning.
So I am Zxiakira C. Prodigalidad, a student nurse from National University. May I know what is your name?
My name is Zxiakira Prodigalidad.
Okay, Ms. Zxiakira Prodigalidad. So I am here for today to assist you on your taking your incentive spirometer. So the reason for this is for your inspiratory activity, so I have to assess that, and also for your deep breathing exercises. So this procedure also is done after a post-operative surgery in your lungs to assess you, and also to avoid any difficulty and for assessing your lung capacity. So is it okay for me to continue with this procedure right now?
Yes, of course.
Okay, Ms. Shensen, thank you for your participation. So can you hold this first? So I will do the hand hygiene now. Okay, so I have to assist you first on a erect sitting position. Okay, that's correct. So you have to exhale now. Okay, so you have to breathe in this device to breathe in and also to reach our goal, which is the recorded goal for today is 2,000. So you have to breathe in like it is a straw. So now, okay, thank you, Ms. Shensen. So we have to hold now for 3 seconds. So we have to repeat the procedure. So Okay, thank you, Miss Shensen, for your participation. And so you have to cup now 2 times. Okay, thank you, Miss Shensen, for your participation. So, I advise that you will have to do this 5 to 10 times every hour so that your lung capacity will also improve and decrease. And also, if you feel any difficulties in breathing, you can call me. Or also, we have to record if you reach the goal. Like today, you reach 2,500, which is higher than what we expected for today. So, can you tell me what you feel while doing this procedure? Did you feel any difficulties, or did you feel uncomfortable while doing this?
No, I don't feel anything bad.
Okay, Ms. Shensen, thank you for your participation. So, I will leave this apparatus, which is spirometer, in your table so that you can do this with or without the need to the nurse for assistance. So, I will leave this now. And also perform hand hygiene. So, Ms. Shensen, let me record what happened right now. So, thank you again for your participation, Ms. Shensen. I hope it all goes well for you, and I hope you have a nice day. If you have any questions, you can call for me or other nurses for assistance. Thank you.
Thank you.
Have a nice day. Goodbye. So for the evaluation phase, we will expect that we have reached all the goals and also the outcomes and also the target volume that we explained earlier. And also, while doing the procedure, we also have to make sure that we are observing the client or the patient while doing the incentive spirometer procedure.